Welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. The Delhi High Court has issued a permanent injunction against Dr. Reddy's Laboratories Limited, restraining them from commercially launching any product containing Olaparib API, or any related product. This order came in response to an application filed by Kudos Pharmaceuticals Limited, AstraZeneca AB, and AstraZeneca Pharma India Limited, alleging patent infringement by Dr. Reddy's. Justice Pratibha M. Singh, the single bench, directed that Dr. Reddy's be permanently restrained from launching products involving Olaparib until the expiration of the patent on March 12, 2024, except as permitted under Section 107A of the Patents Act. The suit was related to the alleged infringement of patents held by the plaintiffs for the product Olaparib, marketed as Lynparza, used in treating various cancers. The court took note of the plaintiffs' claim of patent infringement, supported by independent investigations revealing Dr. Reddy's manufacturing license and export permission for Olaparib. The court mentioned the defendant's willingness to undertake not to commercially launch Olaparib before the patent expiry while continuing permissible activities under Section 107A. The Union Ministry of Health and Family Welfare has released expert consensus statements defining admission and discharge criteria for ICUs for the first time. Compiled by 24 experts, these guidelines address various aspects of ICU management, that is, ICU admission criteria. Admission should be based on organ failure, need for an organ support, or anticipation of deterioration in the patient's medical condition. Patients not admitted to ICU, patients with informal refusal, treatment limitation plans, living wills against ICU care, terminally ill patients, futile and low priority criteria during resource limitations are not admitted. The ICU discharge criteria. Discharge conditions include physiological normalization, stability of acute illness, agreement for discharge due to treatment limiting decisions, lack of benefit from aggressive care, infection control reasons, and explicit rationing policies during resource crunch. The Ministry of Health and Family Welfare via the DGHS has released detailed guidelines defining the qualifications and role of an intensivist or critical care specialist for ICU admission with discharge criteria. The qualifications include a postgraduate degree in relevant medical fields, additional certifications such as DM critical care, and a minimum of 1 year of training in a reputed ICU abroad. Experience requirements range from at least 2 years in an ICU for qualified individuals to 3 years for those without formal qualifications. The guidelines stress that the terms critical care, intensive therapy unit are synonymous, emphasizing the specialized management of life-threatening organ dysfunction requiring continuous and intensive observation by a trained healthcare team. A giant uterine mass of 29 kg operated at AIIMS Bhopal. A 44-year-old woman from Singrauli, Madhya Pradesh sought medical attention at AIIMS Bhopal due to persistent massive abdominal distension over 3 years. Previously denied treatment at 2 other hospitals due to the high-risk nature of her condition, she was admitted to the Department of Obstetrics and Gynecology at AIIMS for evaluation 2 weeks ago. The patient, facing difficulty breathing and impaired mobility for a large tumor, underwent a radiological examination, revealing a colossal mass measuring 42-25-35 cm rising from the uterus. Following multidisciplinary discussions, a surgical intervention was planned under the guidance of Dr. K. Pushpalatha and collaborative efforts from Dr. Ajay Haider, Dr. Jyoti Nath Modi, and Dr. Bharti Singh. The critical case was successfully managed. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.